Most women think perimenopause treatment means diet, supplements, or hormone replacement therapy. And while that is true and necessary for some, I want to suggest that it might be a simpler fix. Because what if your muscle pain, joint pain, and brain fog are being amplified by something deeper? Before you jump into the HRT, I would recommend getting this one thing assessed first. Hi, I'm Dr. Kristina Turkewitsch, a corrective care chiropractor in Newmarket, Ontario, Canada. And I help women over 40 feel strong in their bodies again by getting to the root cause of their pain and not just covering it up. In this video, I will explain the hidden link between perimenopause, joint pain, and your nervous system. I want you to understand why solving this now is critical. Most women think that perimenopause is just about hormones. But what if I told you that your nervous system is amplifying? It's amplifying that joint pain, stiffness, and instability. So here's what's happening. During perimenopause, estrogen fluctuates, which is necessary to protect joints and reduce inflammation. Our collagen becomes less resilient, so ligaments and tendons become more stiff. Muscle tone decreases. With estrogen and progesterone already fluctuating, testosterone takes a hit as well. So this makes it harder for women to build and maintain muscle. And then inflammation is increasing because of the imbalance in our estrogen and progesterone. So with all of these physical and hormonal changes happening, let's add on top of that our nervous system dysregulation. So essentially long hours sitting at a desk that causes postural strain. This results in forward head posture, rounded shoulders, and a neck hump. It's that little bump at the base of your neck that you just noticed. Add chronic stress from juggling work and home life, busy weekends, and all of your children's 1,000,001 hobbies, and sleep deprivation from stress and your fluctuating hormones. Essentially, your spine and your nervous system become overstimulated. Already the body is dealing with declining hormones, which increase cortisol in the body. Add on top of that an overstimulated nervous system, and the anxiety starts to become unbearable. So all this added stress makes your nervous system have to choose, essentially, between our rest and digest setting and our survival setting. And let me tell you, it's going to prioritize survival. When the spine loses alignment, the nerve communication changes. We have these misalignments because of any chemical, physical, or emotional trauma that we encounter, and our spine has to adapt to that. And when it adapts, it always adapts away from normal. So this shift really decreases or causes a change in the communication between the brain and the body and escalates the physical stress. And the body then has to choose what it focuses on. And let me tell you, it's going to focus on things that keep you alive. So your heart and your lung function, immune system and temperature regulation, and all the other necessary body processes that we need to live. The hormones and the hormone cycle become optional and are of the lowest priority. So this will in turn affect our muscle activation, our joint stability, our stress hormone regulation, recovery, and sleep cycles. So now perimenopause symptoms are amplified and feel worse than they potentially would be if your nervous system was properly regulated. Not only is your body stuck in stress because of the physical changes you're dealing with, now your hormones are down-regulated because your body is choosing survival. And so it will get stuck in that survival mode. You'll have more stiffness, more anxiety, more weight gain, more instability, more joint pain, and the list continues. So I'm trying to instill in you that the problem isn't just hormone health. It's the structural stress layered on top of the hormone change and chronic stress, and it puts too much strain on your nervous system. And so a nervous system crash is almost imminent. If this is something you feel you're dealing with, you're not weak or too old or too far gone. Your body is simply overwhelmed. In the next video, you will find out what you can do right now to start calming the stress response and rebuild stability. Definitely check this out because I'm going to be giving you one simple daily reset to reduce stiffness and improve stability and calm the nervous system so you can get started feeling better today. Thank you so much for watching. And if you found this video valuable, please consider subscribing, give it a like, and share it with anybody you feel might benefit. So you can get more information on how to strengthen your body and keep it strong as you age. Please leave a comment if you have any questions. So check out the next video.